To health issues concerning hospitals and nurses, Netcare is very concerned over a shortage of nurses. There's a shortage of up to 62,000 healthcare workers in our country at the moment.
Now, the country's largest private healthcare network says that this is putting both the public and private sector at risk. It says the crisis is partly to blame on government's restrictions on private sector nursing training. Now, Netcare previously trained over 3,000 nurses annually. It's now restricted to a fraction of that number.
Another issue is that a significant proportion of healthcare professionals are set to retire by the year 2030.
Unfortunately, is that there's a shortage of about between 26,000 and 62,000 nurses in the country, depending on which study you look at, and there have been independent studies commissioned by various consultancy agencies. We've been at this since 2016, offering to train as the private sector some 50,000 nurses. Unfortunately, that has been blocked. But the real cause for concern is that this is not dissimilar to the crisis we face with Eskom. Government was told in 1998 that there would be a whole range of power stations that were ending their useful life, that were coming to the end of their useful life. And on a similar vein, we know that up to 40% of nurses currently registered will be reaching retirement by the year 2030. And so we urgently need to fill that pipeline with new nurses, young nurses, and people willing to come into the healthcare sector and to be trained as healthcare workers. We used to train 3,500 nurses in Netcare a year. We've been limited to 360 this year. There have been similar limitations put on the rest of the sector, and I know that the rest of the sector has been limited to about 800 a year. The curriculum has changed, the accreditation process has changed. I believe we've met all of those criteria on the tin, and there is no excuse not to allow the private sector to be training more nurses. And in a country such as ours, which has one of the highest unemployment rates in the world, and we have people screaming to be trained. We have over 14,000 people applying every year just to be trained. We're appealing to government to allow the private sector at its own cost. We're not asking for subsidies. We're not asking for any department to pay for this. We as the private sector will do so that we can provide adequate care across both the public and private sector.